Today is a great day to talk about biopsy. Now, what is biopsy? Biopsy is a way to take a specimen of the patient's mouth, in this case for dental students, and to examine it under a microscope. The biopsies are one, aspiration, fine needle, core needle aspiration, and punch biopsy. There is also brush biopsy that does not require anesthesia, while the previous fine needle aspiration is not painful most of the time, and the difference between it and the core needle aspiration is that it is less painful and smaller and used to take specific cells like lymph nodes and paralymphatic nodes or thyroid nodes. The punch biopsy can be administered in local anesthesia, scraping some tissue of the patient's surface area, and it is used superficially. These are the 4 types of biopsy, and in general biopsy there is other way of classification, having incisional and excisional biopsy. Of course, the excisional being taking the whole biopsy out, which is also a treatment for the benign or malignant tumor when it is less than 1 or 2 centimeters, while the incisional biopsy, the lesion is larger than 2 centimeters and a small incision is made and a specific specimen that is carefully obtained, and then a report will be made upon this incision. There are some lesions that might be taken immediately from the patient. The features of such lesions are that those lesions obstructing functional behavior of the normal function of the patient. Other important feature is that such lesions could cause pain severely and grow rapidly. Also, if there is no radiographic and feature and shape of the tumor does not represent a well-defined, well-known feature that is previously obtained or clinically obtained. Therefore, we use such biopsy immediately. And of course, biopsy is, the definition of the biopsy is obtaining a tissue from a living organ, from a living patient or a living specimen or species, taking this to further investigation. There are more features of such benign or malignant tumor that is unknown, therefore we use biopsy immediately, such as bleeding, and we mentioned other features of why we should take the biopsy immediately. To build a report next, and before making a report, we should be careful not to play with the biopsy specimen, not to color the outer layer of it with antiseptic, not to palpate it, not to, of course, use methods that are not mentioned in the way of taking the biopsy. All specimens, especially on the peripheral part, from the normal and infected tissue must be taken. Not from the central abscess, but from the periphery, of course. And if it's deep lesion, then a deep biopsy must be made in order to take such important cells that are affected. From the stroma and from the bone lesion, there is a separation must be made so that we can differentiate between them. And after the biopsy is taken, all the specimens are sent to the laboratory. Even the small ones are also important. The report that we will make contains 5 parts. The first is name, biographical, geographical address, and general history information of the patient. Second is the gross examination of the biopsy, general descriptions. Third is the microscopical description, which is an optional part that we might mention to determine the histological aspect of such specimens. Fourth is the most important part, including the diagnostic, the site of where we took the biopsy, the organ, and the type, if it's from bone, if it's from the skin, or stroma, etc. And the fifth is a final note. The surgeon might put generally why we do this, some kind of biopsy, why we started to take a biopsy from the certain side of the patient, why it was taken first from this side, not first from that side. It's an optional note that the surgeon might put. He can include any information that he would feel that it is important in the diagnostic of the patient disease.